afternoon, ladies and gentlemen. Welcome to Nurses News Network. My name is Michelle Dunphy, and I will be your host today. Today I have a research team with us. I have Jennifer Capshaw, Joshua Buckley, and Reed Hoffman here. They recently did a study on oral sucrose for decreasing pain in infants. Specifically, you guys had mentioned that the question you asked specifically was, if in infants and children, does oral sucrose compared to no oral sucrose have a positive outcome on pain relief during and after invasive procedures? Can you tell us why this research is significant?
My research group found this topic important to nursing because in the first few months of life, infants and children experience many forms of pain, from vaccinations to circumcisions. To minimize exposing infants and children to more drugs, we were interested in non-pharmacological pain reduction methods. As nurses, it is part of our job to ensure that we are minimizing unnecessary pain for this vulnerable population. I found many different protocols and reviews on using oral sucrose to decrease pain. I wanted to fully explore all of the research that was currently existent regarding this topic and see where some holes may lie.
Wow, that was actually a very interesting research question. I can really see how the importance of the research that you guys have done really relates to the nursing field. Can you guys tell me a little bit more about this research question?
After our group developed the question, we began trying to figure out how exactly we were going to research this topic. We chose to search all databases and EBSCOhost for maximum results. With our first search, we actually used the keywords sucrose, neonates, and pain. This initial search gave us over 5,000 articles. Over the next 5 searches, we decided to gradually add more limiters in order to provide us with the most relevant articles in relation to our research question. The additional limiters that we decided to include were the following: age group, which was all children; published date, since we wanted to keep our research results as recent as possible; the English language; having at least one author as a nurse; scholarly peer-reviewed journals; and full-text articles. After adding these limiters in order to make our search as specific as possible, we ended up with 22 articles that we could actually choose from.
Wow, you guys did a lot of narrowing just to find your specific articles.
Yes, so once we actually got to those 22 articles, we performed a careful analysis of these articles in order to provide the research group with the top 8 research articles to actually use. This means that we excluded 14 articles from our research that were not as relevant to our question, and we wanted to use research articles that were at the highest quality. This left 8 appropriate and relevant research articles. Each of these articles was focused on our target population, which was neonates and children. Also, each of these articles were either testing or reviewing our particular intervention and time frame. So we used these 8 articles to answer the question that we posed.
So, can you tell me a little bit more about your findings?
Overall, my articles definitely supported the use of sucrose in reducing the infant's pain. One of my articles, written by Teresa Hardcastle, poses the question of whether oral sucrose solution could be used for pain reduction or during and post procedures in neonates. The article was an analysis of other studies that had been done before, such as RCTs. Hardcastle found that the use of sucrose showed a marked decrease in the pain scale used, and that is a great low-cost option for managing pain. This research study is exactly what we are looking for and helps to support the evidence we have already seen. The second article I found was truly just a summary of a previous article. It was written by Sharon Lyons, who is a registered nurse, and discusses the usefulness of sucrose in reducing the pain score after procedures for neonates, very similar to my first article. This article told us that in the studies that were included, 64% showed a favorable reduction in the pain score when sucrose was used. Even though this article is only a summary of other studies, it's useful for getting past all the extraneous details. However, this does make it difficult to figure out specific questions that need answering to determine the validity and usefulness of this article.
Well, I actually did 2 articles coming off Reed's. Matt Erickson and Emma Olson, they did a oral glucose for pain relief during eye exams for retinopathy. The study was aimed to determine whether oral glucose has a pain-relieving effect during eye exams. The study was a randomized controlled study that was double-blind. They chose 30 infants who were born before 32 weeks and weighing less than 1,500 grams. The study randomly gave either 1 milliliter of 30% glucose or 1 milliliter of sterile water, which was the control. Examinations were recorded and graded by a professional PIP scorer. There was a minimal difference between the two groups during eye exams, which makes us wonder if pain is physically different depending on location. Is the pain worse for eye exams compared to venipuncture or heel sticks? In our research proposal, we look to focus on one type of painful procedure. The next article I found research on, Denise Harrison decided to do sucrose and lollipops to reduce immunization pain for toddlers and young children. The study is looking to find if sweet taste helps reduce pain in toddlers and preschool children. In a similar way during immunizations similar to neonates, the design is a 2-pilot randomized controlled trial. They chose 12 and 18-month toddlers and were given 33% sucrose before immunization, and preschool children were either given a lollipop before or after the immunization. FLACS score was used to score the pain, and the results showed minimal significant difference between the intervention and control groups for both toddlers and preschoolers. However, researchers question if pain is physically different between toddlers and preschoolers because the brain is physically maturing and the children are understanding what painful stimuli are now.
One of the articles that was reviewed was titled Hospitalized Infants Who Hurt, a Sweet Solution with Oral Sucrose by Tracy Ann Pasek and Jessica Marie Huber, who are both registered nurses. The article was actually written in 2012, and this article posed the question, is oral sucrose analgesic for infants as pain management strategy during and after invasive procedures effective? This question was explored using a non-experimental descriptive case study, using 2 infant patients undergoing an invasive procedure. The patient's age equaled newborn and 4 months. The results of this study concluded that oral sucrose reduces but may not actually eliminate all pain, and that sugar is safe and effective for infants who experience minor invasive procedures. The researchers still had questions regarding the optimal dose in the conclusion of this study. So along with that study, the research team actually looked at an additional article that was reviewed. This article was titled, Using Non-Nutritive Sucking in Oral Glucose Solution with Neonates to Relieve Pain, a Randomized Controlled Trial. This article was written by Mr. Liu, who is a nurse, and 4 other medical doctors. This article was written in 2010 and posed the question, does non-nutritive sucking or oral glucose solutions help to relieve pain for infants undergoing venipuncture? This question was explored using an experimental randomized parallel group controlled trial. This trial consisted of 105 neonates awaiting a venipuncture procedure with a mean age of 3 days. The results of this study actually concluded that non-nutritive sucking and glucose solution groups both had lower pain scales than the control group, which had no intervention. The research did, however, find that non-nutritive sucking seemed to be a little more effective than the glucose solution.
Well, that's really interesting. So we all know that infants really undergo lots of procedures, especially when they're born. And a lot of these procedures are pretty painful. So 2 other articles that you guys had mentioned brought up kind of the same topic about these the sucrose decreasing these pain managements. One specifically asked this question as to whether or not non-analgesic methods of pain control are effective to neonates in minor procedures. This was evidence-based literature that you guys had found using clinical trials. And you had found that this oral sucrose should be used in pain reduction and intervention in infants up to 12 months of age undergoing these minor painful procedures. You guys found the proven effectiveness, the low rate and the minor adverse events that it causes, the ease of administration, the accessibility to it. However, you did mention that you felt that there is this need for further research to be done. Is that right?
Yes, that's exactly right.
The team had come across an article that I thought was really interesting. It actually used a double-blind study, and you were looking at the specific amounts of glucose to give to these neonates. I thought this was a very interesting study in reducing the pain and just the specificness of the research. Can you tell me more about this article?
Well, according to this article, newborns are even more sensitive to pain since they lack the ability to inhibit some pain receptors. So every time pain is inflicted on these little ones, the whole body can be affected from cardiovascular system, raising their heart rate, which leads to an increase in metabolism and intracranial pressure. Long-term side effects can lead to psychological issues such as anxiety that they will have to deal with throughout their life. The more we can prevent these excessive painful stimuli, the more opportunity these infants have in focusing their energy toward more important aspects of development. This double-blind clinical trial tested different levels of glucose in a placebo group and compared each with a pain scale to see if using glucose actually does affect pain scores and how much is most effective for the infant.
So that's a really great point. You know, we may not fully understand how much pain truly affects us, even as just a neonate. Can you guys tell me a little bit more about the sample used for this specific study so that our viewers can really understand who we are talking about?
Sure. This study focused attention on stable newborns born after 32 weeks gestation who underwent venipuncture between November 2007 and March 2008. This article excluded unstable newborns who had had respiratory support and neurological abnormalities, such as newborns who had received sedatives, analgesics, and naloxone 48 prior to procedure. These items could affect how they react to pain and would skew the results. From these specifics, 246 of 304 newborns were chosen based off the limitations and signed consent of their parents.
So you've mentioned that this is a double-blind study. Can you explain to me and your viewers how the data was collected and bias was avoided?
Well, 2 members of the research team were present at the time of blood draws from the selected neonates, and the nurses and midwives administering the procedure were taught the specific variables to be used in the environment. The study made sure the other comforting factors such as swaddling, parent or researcher touch, and pacifiers were not used to reduce pain. A blind concentration of glucose solution in sterile water was administered 2 minutes before the venipuncture, and the researchers used the Leuven pain scale and heart rate to determine the effect of the glucose. Only the pharmacist knew the percent of glucose in each vial administered to the infants.
I really think this study was really well thought through when it came to controlling their variables. The authors looked at everything from newborns and nutrition, number of punctures that they used, how old they were, and if they were susceptible to increased bilirubin. So tell me more about the main findings. I'm going to ask you a series of questions that really bring this article to life for our viewers. So would you say that this study published in a source that required peer reviews?
Absolutely. It is definitely from a peer-reviewed journal. We were sure of that.
Do you feel that using a double-blind study was effective for this research?
We do. The solution was only known by the pharmacist, making this a double-blind experiment for both infants and nurses and doctors. With these double-blind studies, we erase bias from the researchers.
Interesting. Did the data obtained and the analysis conducted truly answer your research question?
Absolutely. The 30% glucose solution proved to be the best option for the reduction of pain.
I agree. Were the instruments that you used reliable and valid?
Yes. A validated pain scale, the Leuven pain scale, and heart rate were used to measure the level of pain. However, measurements were only included if puncture procedures were successful.
All right, that makes sense. How do you feel if whether or not the extraneous variables and the biases were controlled?
For the most part, absolutely. Several factors were controlled through the inclusion and exclusion criteria. At the end of the article, the authors included a chart of possible extraneous factors. However, one problem was making sure the puncture was performed perfectly and consistently with each infant. This will definitely be an extraneous variable. The mastery of venipuncture is hard to measure and might be a concern between 6 team members.
All right. Tell me a little bit more about how the controlled extraneous variables were actually controlled.
Well, we weren't really clear on this. The location of the study was both the maternity and neonatal wards of Heelig Heart Hospital in Mol, Belgium. The only extraneous variables we may have is the 2 different wards and differences in venipuncture. Neonatals might require infants to receive punctures during hospital stay. More punctures during the hospital stay. A question that we asked while reading this was, does this cause anticipation to pain compared to healthy infants in a maternity ward?
All right, that makes sense. And were these participants randomly assigned to each group?
It's really not clear from the article. Random sampling was not determined, while 250 parents were invited to the study. Inclusion criteria required all patients who were undergoing venipuncture procedure. For the exclusion criteria, we had whether they were unstable, basically if they had any respiratory issues or respiratory support, or if they had any neurological abnormalities. Infants who had been administered sedatives, analgesics, or naloxone during previous 48 hours, and premature infants under 32 weeks gestation were included in our exclusion criteria.
All right. And then how do you feel that these interventions were defined? Were they well defined and consistently delivered?
Well, we believe so. 3 glucose solution groups, 10%, 20%, 30%, and a placebo control group, which was sterile water. Solutions were given 2 minutes prior to painful stimuli. The nurses were also briefed on the procedures to ensure consistency with the procedure.
Makes sense. Were the groups treated equally other than the differences in interventions?
Unfortunately, we'd have to say no. Only the last puncture was scored if more than one puncture was necessary. 7.2% of the population needed more than one puncture attempt for successful testing. This means 7.2% could have had increased pain scores due to several pain stimuli.
All right. Do you think the sample size was large enough to detect a difference?
Well, there was a difference present, so I'm going to let Reed go more in depth on this one.
Okay. The differences that you guys did find, how confident that it was due to the intervention?
A power analysis was not performed, so we cannot determine if the 246 infants were an adequate sample size. We noticed pain was reduced with 10% glucose solution, and pain reduction continued to increase as the glucose percentage was increased.
Okay. Are the findings consistent with the findings from all your other studies?
We aren't sure. Other studies have tested several other factors, including sucking reflex, crying time, and amount of time in between oral glucose and venipuncture. However, oral sucrose has been successful in other studies.
All right. Can you tell me any of the differences between your means, your R-squared, measures of clinical effects?
Right now, we know that 30% oral glucose showed a significantly lower pain level than the placebo of just water, as well as 10% and 20% also showed to have a lower pain level than the placebo. 4 groups were statistically significant and different because of p-value less than 0.001.
All right. And then was their target population clearly described?
It was. The target population were infants who had to undergo a venipuncture as part of their medical care. The excluded was the infants required respiratory support, as Reed stated earlier, neurological abnormalities, administered sedatives, analgesics, or naloxone in the previous 48 hours, or premature infants under 32 weeks.
All right. And my last question for you guys, is the frequency, association, or treatment effect impressive enough for you to be confident that the findings would make a clinical difference if used as the basis for care?
As I stated earlier, they are definitely statistically significant with the p-value of less than 0.001. Hospital protocols are in place for the studies, especially oral glucose and the sucking action.
Though this study is not a systematic review to the double-blind experimental study, this research has a high level of evidence. I believe these researchers did a good job at controlling the environment and keeping extraneous variables in mind to ensure they have the most accurate results. So, the research group found this article to be credible and clinically significant. Using this information in the clinical setting can be valuable to decreasing pain for the infants, decreasing anxiety of the parents, and reducing unnecessary cost.
Wow, so it seems like your group really found a lot of information and have done really in-depth research based off of this topic. How would you tie all this evidence together regarding your research question?
So, overall, it did seem that there was adequate literature to help guide our research team in finding an answer to our PICO question, which was, just a reminder, in infants and children, does oral sucrose compared to no oral sweets have a positive outcome on pain relief during and after invasive procedures? Although not every article that we found was statistically significant, most of the articles did have clinically significant results. The consistent clinical significant result was that On average, pain scores for infants was lower for those who received oral sucrose compared to those who did not receive any oral sucrose. Although we did find these wonderful clinically significant results, there were some limitations that were consistently found in each of the articles. One limitation specific to our PICO question regarded the age group that oral sucrose is optimally used for. The literature supported that oral sucrose is most effective in infants under 12 months of age, rather than children. Pain scores tended to increase after this 12 months of age. For this reason, in our proposed project, we limited our population down to only neonates, rather than our original population target, which was neonates and children. Another primary limitation regarded optimal dosage of oral sucrose in order to relieve pain. This topic needs to be further studied. Finally, the last limitation that seemed to stick out regarded non-nutritive sucking and whether this intervention could be used in combination with oral sucrose in order to find maximal pain relief results. We also explored this topic further in our new proposed study. Overall, the research group concluded that additional research is needed regarding the dose response in different infant age groups, optimal concentration of sucrose solution, the need for multiple sucrose dosing, adjustment for multiple painful procedures, and addition of optional non-pharmacological intervention as a combination approach. Our research team would determine from the literature that oral sucrose is safe and effective as an intervention for neonates undergoing minimally invasive procedures, meaning that overall the literature available does answer our research team's initial PICO question. Oral sucrose is a good intervention for pain for many reasons, including that it is proven effective as an analgesic, it has a low rate of minor adverse effects, it is easily administered and readily available. We would recommend, as nurses and researchers, that nurses and parents involved with neonates be made aware of this research and that oral sucrose be made available for them as an option for neonates undergoing any acts that could inflict unnecessary pain.
That's really interesting. With all this new information in mind, do you guys have plans to implement your own research proposal to research this topic specifically?
That's a great question. We actually have considered a couple research designs. The subject that we decided on is on researching which method reduces pain in infants under 12 months receiving heel sticks. We would have 3 experimental groups. We would have the control group first of all, which would have no intervention. Then we would have intervention 1, which would be pacifier and water. Intervention 2, oral sucrose 20% concentration with no pacifier. And intervention 3, oral sucrose 20% concentration with pacifier. The sucrose and pacifier are administered 2 minutes before and after heel stick, along with the pain score we'll get. All interventions and actions need to be the same. Same pacifier, same sucrose solution, same heel punch, okay? The same placement of the heel stick and not comparing it to needle sticks. This is very important because the pain will be different. A power analysis should be used to determine sample size. More specifically, a clinically superiority design should be used. A convenience sample would be used in order to recruit neonates based on the inclusion and exclusion criteria undergoing minimally invasive procedures at the hospital where the research team works. The inclusion and exclusion criteria includes full-term infants, 37-week plus gestation, okay? Require heel stick for lab analysis test. 3, has not received any sedatives, analgesics, or Narcan in previous 48 hours. We would need an APGAR score of greater than 7, both 1 and 5 minutes, okay? The infant does not have any neurological or life-threatening abnormalities, okay? So basically the infant isn't on life support. The hospital staff would be trained on exactly how to recruit members, and parents must give consent in order for the ethical category to be fulfilled. This could cause issues for enrollment as parents will not want their newborn child to suffer from the chance of getting the placebo. This would technically be classified as a factorial experiment based on the number of factors being tested in the different groups. The newborns would be assigned completely at random to the control or experimental group. The pain score we would use is called NIPS, or Neonatal Infant Pain Score. It is a basic and simple score used in many hospitals that has been tested for reliability and validity. The basic scoring includes measuring the facial expression during crying, breathing patterns, arm and leg movements, and the state of arousal. Now, these points will lead us to the scoring system, which is 0 to 2 being mild or no pain, 3 to 4 being mild to moderate pain, or greater than 4 being severe pain. The pain score, again, would have to be taken 2 minutes before and 2 minutes after receiving the heel stick. This is very important. Appropriate statistical analysis would then be used to analyze the results of the study.
Oh wow, that proposal sounds really interesting.
Yeah, we're all super excited about it.
So after your team has completed this research proposal, how are you going to disseminate this information?
My team actually had several ideas on how we would like to disseminate the findings among the various nurses working with this specific population. We would actually like to provide information sessions at each of the hospital units that take care of neonates. This information session would primarily focus on the vast variety of painful procedures neonates undergo within their first few days of life. We would then begin teaching about how it is a part of the nurse's role to provide comfort and pain relief for this population in the most beneficial way. At this point in our session, we could then go into detail about the use of oral sucrose as a pain relief measure. The research team would talk about its ease of administration and minimal adverse effects. We would then talk about the proof of the intervention using the literature available, as well as the research project we will have carried out at this point. Finally, we would also like to disseminate these findings to the families that care for neonates. Possibly, we could do this through the use of pamphlets, which would provide all of the information easily. This information would obviously include oral sucrose as a non-pharmacological way to relieve pain for neonates during invasive procedures. The more educated families are, then they are then easily better equipped to care for their family members after they have all this helpful information, which is why we have decided to not only disseminate the findings to nurses, but also to the families involved.
Well, wow, I think you guys have done such a great job at your research and coming up with a proposal on providing this information to the public. Thank you so much for providing all this information to us. Viewers, I really hope you enjoyed our broadcast today. And now to Jack Hale for your weekly weather.